Hello, Persuasive Speech. My name is Jennifer Canela. I'm in your CMST 109 class. So, sexual education in high school. Should that be a requirement? Yes or no? I say yes, and I will tell you why. 3 main points. First, teens and STDs. Second, teen pregnancy. Third, sexual abuse. Now, teens and STDs. Many teens have unprotected sex. According to DoSomething.org, between the age of 15 and 24, we account of 50% of STDs reported in the United States. Now, that is a lack of sexual education in our system, in our community, in our country. That is one of the main reasons as to why sexual education should be a requirement to graduate high school, especially in high school where the peak of hormones and sexual acts are so high upon. Now, studies shown that only 46% of students asked in high school use protection. That is 6 out of 10 sexually active people. Only 6 used protection. Now, of course, these STDs and STIs can go many ways. We're talking about AIDS, gonorrhea, chlamydia. Of course, many of those can be treated with antibiotics or other short forms. But for HIV/AIDS, that is something you live with for the rest of your life. That is affecting a big portion of our community, as many of our young adults are not comfortable talking to their parents or their, father, motherly figures about sex in general. So, should sexual education be a requirement in high school? Yes. Now, teen pregnancies. There was a big leap in teen pregnancies probably around 2014, 2015. I saw lots and lots of teen pregnancies, and that's when many TV shows aired, like MTV Teen Mom, The American Life of a Teenager, just because they were trying, our community was attempting to drop those rates that had peaked up so high. Now, the lack of sexual education in our community causes our teens not to know how to protect themselves. There's many different ways of protection if you're going to decide to have sexual intercourse. Condoms is the easiest and most known. There's always contraceptive, oral contraceptive, or even implants now. Technology is very advanced. Now, in 2017, there was a total of 194,000 babies born from teens in 15 and 19 years old. That's a lot of babies for teens. How does this really affect us when you're a teen mom? You don't finish high school. And that's a big issue. Only 50% of teen moms actually graduate high school. The rest of them drop out. They give up. It's too hard. You cannot physically be a student and a mom and a wife sometimes. It's so hard. Therefore, it does affect not only how our life changes as a teen mom, but it affects our education. We don't finish high school. That means we will be in low-paying jobs. We don't have a career to fall back on. It affects us in many more ways than we really see. According to MarketWatch.com, in 2015, the public assistance, now when I say public assistance, I mean welfare, food stamps, Medi-Cal, it's all free things that we pay for in our taxes, dispensed a total of $4.4 billion to parents that were teen moms. That's a lot of money. That could have gone to education. It could have gone to helping students out with how much they pay for college, scholarships. It could have been utilized in a different way. Only if sexual education was required in high school. Third, sexual abuse. To many, sexual abuse means rape or sexual acts that are not consensual. It's not only that. Sexual education will teach us that sexual abuse includes verbal abuse from our partners, physical abuse from our partners, ways that we should be treated, that we should have a standard to meet up to. Sexual abuse comes in many, many different ways and manners. And sexual education will be able to teach us that if it is a requirement, leading to healthier relationships, leading to better mental health status. A lot of teen moms that suffer from sexual abuse or unhealthy relationships end up being depressed. They end up drinking, smoking, doing illegal drugs. Why? They have no escape from their reality. Therefore, yes, sexual education should be a requirement in high school. Why? It will help prevent or really drop down the numbers of teens and STDs or STIs, teen pregnancies, as well as sexual abuse. Think about it. Let's change it. Let's make it a requirement.